Whoa. Oh, fuck.
Okay, you got me now.
Hi, Sharon. How are you?
I'm good.
11 people on the call already.
Oh, okay.
Let me put you on shared screen.
Okay. I'll be right back. I'm gonna go pick up something that's printing.
Okay. Good evening. This is Leonard Andriuzzi. I'm the president and CEO of the Lupus Foundation of America, New Jersey chapter. I want to thank you all for attending tonight. We few little rules. One, you're all muted, but you can ask questions on the question and answer format. And if we don't get to all your questions, you can always ask those questions of your local chapters. We hope you enjoyed tonight's presentation and seminar, which is being brought to you tonight, as I said, by the Lupus Foundation. And our guest speaker is Dr. Sharon Boyd-Jackson, who's a licensed psychologist who has been trained in the field of clinical psychology. She is also a doctorate degree from Derner Institute of Advanced Psychological Studies at Delphi University, Garden City, New York. Dr. Boyd-Jackson has 25 years plus experience at practicing psychologist. She's the sole proprietor of Empowering Self, LLC. She is a past president of the New Jersey Chapter Association of Black Psychologists. She's also the past co-chair of the New Jersey Psychological Association Academic and Scientific Affairs Committee. She has presented and published on topics related to racism, prejudice, and domestic violence, and presented on topics related to clinical disorders. Dr. Boyd-Jackson is presently an associate professor in the School of Psychology at Kane University. Dr. Boyd-Jackson maintains an interest in community concerns that help to promote individuals of African descent. She is also a co-leader of our support group for the Lupus Foundation and is presently running the virtual support group for us. She also co-leads the bereavement and depression support groups that are open to the community at St. Matthew's AME Church, Orange, New Jersey. At this time, I'd like to present Dr. Sharon Boyd-Jackson. Dr. Jackson.
Okay, thank you. Hello, everyone. I am going to share my screen so that we can begin because we don't have a lot of time. And I do have some things I'd like to share with you. So this presentation today is, whoops, I'm starting at the beginning here. So this presentation today is going to be looking at depression and anxiety and coping with SLE. I am a clinical psychologist. This is my email. If you have questions that I can't answer during this presentation, you can certainly email me. Okay. All right, so I'm going to start with just talking about the prevalence. We know that lupus, the prevalence of lupus is 20 to 150 per 100,000 persons, and 150 per 100,000 in white women, 400 per 100,000 in African American women. So it's approximately 2 to 3 times more prevalent in women of color, as you can see. In the general population, when we talk about depression and anxiety, we know that these are common emotions that people have. But in the general population, 7% of the general population has a prevalence of major depression, but 9.7 for any mood disorder. And as you can see, 31% for any anxiety disorder. So you can see anxiety disorder is at least, 3 times more prevalent than any mood disorder in the United States. So one study actually estimated a 25% diagnosis of mood disorder and 37% of anxiety disorders in SLE patients. Another actually reported specific depressive symptoms as high as 75% in SLE patients, and estimated 50% will have the diagnosis. So there's a difference there you see in the variation, 50%, 25% in terms of diagnosing the diagnosis of mood disorder. And we'll talk a little bit about that later, that difference and that variation. Gender differences, there's also gender differences in anxiety and depression in the general population, with females having 8.7% and males 5.3% for depression. And when we look at anxiety, females are twice as high for anxiety disorders, prevalence of anxiety disorders than males. 23% for females, 14% for males in any given year. Mood disorders, according to the DSM-5, the Diagnostic and Statistical Manual of Mental Disorders, I want to just talk a little bit about sort of identifying and clarifying depression, because sometimes we talk about depression and we are looking at maybe some depressed symptoms, but not the exact diagnosis. So in order to diagnose major depressive disorders, you need to have at least 5 of the criteria symptoms that occur within a 2-week period. And some of the symptoms, insomnia, fatigue, lack of appetite, overeating, etc. Persistent depressive disorder is one of those depressive disorders that we don't hear too much about, but I like to call it characterological depression because it is chronic, enduring, and long-lasting. And in order to be diagnosed with persistent depressive disorder, you have to have at least 2 years of depressive symptoms. So it's ongoing, almost daily. And there is also a depression due to another medical disorder. And this may be related to lupus, a medical disorder that is causing the depression. And that's what we'll talk a little bit more about, because the causal factor of depression, is it due to lupus? Is it due to something else? So if it is due to lupus, we would probably be looking at this diagnosis. Number 4, other specified depressive disorder. A person would get this diagnosis if they don't meet the full criteria for any specific depressive disorder. So they may only have 1 or 2 of the depressive symptoms. And sometimes when researchers are looking at lupus and depression, they may be only looking at a couple of symptoms as opposed to a full-blown diagnosis. And when we think about substance and medication, the induced depression, the substance or medication ingested has to have the properties to induce depression in order to reach this diagnosis. And of course, there is no evidence of depression prior to ingestion. And when the medication substance is out of the person's system, then the depression would subside. Same thing for anxiety. Now, the one disorder that I thought that might be related specifically to SLE is generalized anxiety disorder. As you can see, the restlessness, difficulty concentrating, you may recognize some of these symptoms, fatigue. For generalized anxiety disorder, a person has to have at least 4 or more of those symptoms within a 6-month period. And same as the substance medication has to be ingested before you can see anxiety symptoms. Anxiety due to a medical disorder would be the causal factor. And then other specified anxiety disorder would be some symptoms, but not a full-blown disorder. So how does depression and anxiety disorders relate to systemic lupus erythematosus? There are several studies that have looked and connected lupus and depression. One study, Excel, looked at this is a pan-European population, so different countries in Europe and versus healthy controls, and found that the levels of anxiety and depression were higher in SLE patients than in healthy controls. And they also found that the most common complaints, fatigue 50%, joint pain 18%, pain, chest pain, rash, no complaints. And the presence of depression in SLE was 16% compared to healthy controls, which was 6.7%. So you can see that there is a big difference there. Only 7% of participants with high depressive scores used antidepressants. Now this sort of shows that the antidepressants were working for some. But there was that small percentage, 7%, that actually had high depression scores, even though they were on antidepressants. And it's interesting that there was no association found between the severity of the disease, severity of lupus, active flares, and depression. So depression was not necessarily higher when someone was active in the disease or had active lupus. Paganini conducted a systematic review. He actually looked at several studies and the relationship between SLE and depression, and concluded that there was a variety of assessments, a variety of methodology, different research designs that sort of clouded exactly any clarity for the relationship. There was also a lack of strong biomarkers that made it difficult to identify any substantial evidence of the relationship between SLE and depression. And when I talk about relationship, we're really talking about the causal relationship. We're looking at causal relationships. Paganini concluded also that future research needs to focus on maybe the type of depression and also symptoms specific to SLE, a relationship of suicidality, and specific biomarkers. The specific biomarkers would then help with understanding, I guess, more of the medical aspect of medical treatment for depression. McKay focused on assessing a biologic perspective on cognitive impairment, depression, and fatigue in SLE, and found that again, the lack of clarity in the psychiatric condition, because she felt that there were many factors that kind of complicated the relationship, the medication that the person may have been taking, hormonal functioning, infections, and comorbid illnesses that may also be related to depression as well as SLE. She also was interested in the central nervous system and found that there was an inability to sort of take tissue biopsy for neuropsychiatric symptoms in relation to the central nervous system, and that made it also difficult to look at the relationship from a biological perspective. And so again concluded, we need to have more accurate biomarkers to develop medication solutions. Figueredo Braga focused on the biopsychosocial factors in SLE, and found that SLE had the highest indication of depression rather than the rheumatoid arthritis group or a depression group. So he looked at 3 different groups in SLE, rheumatoid arthritis, which is also one of the inflammatory diseases, and a group that had depression without any medical complications or illness, and found that SLE had the highest indication of depression. Also found that SLE in the depressed group had similar anxiety scores, but they were, SLE was higher in anxiety than the rheumatoid arthritis and the healthy controls. So we're seeing in some of these research that there is a high association with depressive symptoms. SLE patients reported lower satisfaction also with their relationship, and like that was the psychosocial aspect of this study. And concluded that this was that probably more studies should be done in this respect, because you're looking at 2 diseases that have chronic inflammatory disease with depression, and when we see differences, we can see maybe some differences in the psychological components. Nowicki Saar focused on the perception of SLE illness and how it may affect psychological illness. Now, this is interesting because they found that people that had negative illness perceptions had higher anxiety and depression. And so we're looking psychologically when depending on how a person views their illness, is that causing more or higher anxiety symptoms, higher depressive symptoms. So they also found that patients reported fatigue, poor sleep, and pain, may have some special needs in terms of psychological intervention that focuses on negative illness perception and distress symptoms. So the psychological intervention, they're suggesting that psychological intervention can have some effect on some of the reported symptoms: fatigue, poor sleep, pain. And also suggesting that there may be a need for multidisciplinary care in managing SLE patients. So not just looking at the medical aspect of it, but psychological as well as perception. And the perception is part of the psychological. How are people actually perceiving their illnesses? And how does that impact the symptoms? So other studies have actually indicated other areas of other things that may be linked to the depression. And so this really just shows the complication of depression and SLE. Boltnick looked at the or linked depression to the metabolic syndrome. The metabolic syndrome being several conditions such as hypertension, the diabetes, high blood sugar, high cholesterol. These are things that are also related to inflammation, and the combination of these things, if a person is experiencing them, might also be linked to depression and SLE. Jolly and others focused on the relationship of body image related to alopecia or pain that can change a person's appearance in mediating factors for depression. And when a person is experiencing here the difference in changing in their body, the hair loss, these are things that can relate to a person's self-esteem and influence the development of depression. Tay focused on the psychological and biomarkers suggested by Pagnini, and found again some similar things. And I just wanted to add this because it sort of highlights the fact that anxiety and depression are significantly or tend to be significantly related in SLE than in healthy controls. When studies are done, that the anxiety and what was important here was that anxiety seemed to be more related to active SLE than depression. So if a person is experiencing an active flare, the anxiety symptoms might be more prevalent in an individual. And it kind of makes sense. I mean, when we think about anxiety is, we worry, and worrying occurs with anxiety. And we know that if there is an active flare, that there's going to be more concern about what's going on with your body. How long is it going to last? Is this ever going to end? And how severe is it going to get? So there could be a lot of questions and worrying going on when SLE is active. And also depression was physically related to pain and inflammatory arthritis in patients with SLE. And when I say physically related, they were basically found similar biomarkers for depression and pain and inflammation. And again, that relates to the confusion or unclear aspects of those biomarkers. Are they related to depression? Are they related to, or are they caused by depression? Are they caused by the inflammatory factors? So basically, Tay concluded that and recommended that physicians should formally assess for at least anxiety and refer for psychiatric treatment if a person is experiencing anxiety, especially during a flare or during active SLA. There were some review studies and more recent studies that I wanted to mention before we talk about some of the psychological solutions. Karen Barbera looked at the neuropsychiatric involvement in SLE and basically concluded that there were various antibodies that were linked to neuropsychiatric SLE, but still difficult to differentiate any causal factors. FAGFAM looked at the non-pharmacological therapies for SLE, non-pharmacological therapies, and simply concluded that there's psychological interventions that improved depression and pain. There were actually some, excuse me, there was actually, they looked at the psychological therapies like CBT and looked at mind-body, mindfulness, interventions that seem to help individuals that had SLE, and specifically the psychological interventions seem to improve the depression and pain. And the mind-body components, although they only looked at one in this particular study, so they concluded that there needs to be more research to support the benefits of mind-body components. And when I say mind-body components, I'm talking about things like, you may have heard the term mindfulness, and that's sort of been a term that we tend to see more so, especially in dealing with COVID, with individuals. Excuse me, I'm just going to get some water. So mindfulness is a way to help, I like to say, quiet the mind, that it helps it relates to meditation, and it helps a person become self-focused, and the relaxation can help calm the body, relax the mind, calm the blood pressure, and it has many other benefits. And there is studies that show how mindfulness can help to decrease depression, anger management, and other psychological properties. The last study I'm going to talk about is the Beckerman Living with Lupus. This was a qualitative report that was actually done by a social worker. And in this report, the social worker sort of, let me explain qualitative study first. A qualitative study is a little different than a quantitative study. So they didn't just give questionnaires and assess, how many symptoms or a person may have had. But with this qualitative report, they asked specific questions and looked for different themes in persons' answers. And found that they worked with a lupus population, and they found that there were, I think, 4 themes that arose with this study. The first theme was, if you having lupus, you may have felt this. But before I even talk about the themes, I should say that the population that they actually work with were individuals who may have had been diagnosed with lupus within 2 years, and or within 2 to 5 years. So probably more newly diagnosed. So the first theme was depressed that I'm not who I used to be. And so some of the thoughts that identified this theme were, one person said that I actually feel sad most of the day. I'm trying to go about my business, but it's exhausting. Or I feel bad or embarrassed about how my body looks. Another one, the most troubling part of the course of this, of course, is my actual health. But the day-to-day things makes me feel sad. The day-to-day things that the person goes through, they're saying, makes them feel sad. Another theme was the anxiety about the uncertainty of the illness. And some of the thoughts that were shared about this theme was, one person said, the worst part of this is not knowing when the next flare up will come or how serious it will be. Another person said, I can't do things that I used to do. I can't step on the bus stairs, and I worry I'll start to have more flare-ups. A third theme was coping with the physical and emotional fatigue of the illness. And the emotional and physical fatigue of the illness, one person actually said physically, emotionally, financially, socially, every time, or every front, or on every front, I just feel I can't do what has to be done. Another one said, no matter how many times I try to explain to my family that I just can't do what I used to do, that they don't understand. The fourth theme was, and the final theme, was coping with the financial strain of the illness and medications. And one person stated, people just don't talk about the money aspect of this. I don't have the type of coverage for all these prescriptions that I need. Another said, I thought I had good insurance, but I had to spend so much for my medicine. Another one said, I love my doctor, but I can't afford him. So in this study, they also assessed the coping mechanisms. What were the coping mechanisms that the individual actually used? And they found that some of the coping mechanisms were going to meetings. One person said that their rheumatologist actually has meetings for lupus, and even once a year, that they feel that every time they go to the meeting or any of the meetings, they learn something new about themselves. Another said that their family is very helpful to them. The most helpful thing is the love of family, one person said. Another used religion and felt that, religion helped them through their pain. And lastly, support groups. Another said that I'd be in terrible shape without my lupus support group. Yeah. So these were some of the coping mechanisms. And so Beckerman concluded that coping mechanisms, social and family support, should be part of the comprehensive psychosocial assessment for mental health or medical care workers. So in concluding from the studies that I reviewed, I just want to sum up. We found that both anxiety and depression may be more highly related to SLE than even rheumatoid arthritis or healthy controls. That anxiety may be more related to active and severe SLE than depression. Some of the studies found that depression may be more highly related to fatigue and pain. Some of the studies suggested that mental health care providers should more formally assess for psychological and psychiatric symptoms. And McKay, who was interested in the biological aspect of SLE, recommended that there should be some natural strategies, such as the success of fish oil or antioxidant properties that may help with fatigue. Psychological strategies can be useful for some to help cope with depression. So coping with depression and anxiety. What do you do? What is the first thing to do in order to cope? It is essential to the coping process to identify your symptoms and patterns of behavior. So you can do this by maybe keeping a journal or helping, getting a significant other to help you identify those behaviors. Sometimes you may not feel as well to, maintain that journal. So getting help and asking for help to help for awareness. Help if your significant other can also help you to see whether or not there are any patterns of fatigue. If you're writing it down, you can look at the patterns. How do those patterns, are you fatigued maybe a certain time of the month, or does it come once every 2 weeks, or is it more frequent than that? Sleep problems that are excessive, identifying whether or not your sleep is restless, or you're sleeping too much, or not sleeping enough. And looking at this pattern can also help you of where you really need to be helped, where you really need assistance. Because if you have restless sleep one day and then you're sleeping a lot the next, the oversleeping or sleeping too much may not be the problem, because if you have restless sleep, then you're really just catching up on the sleep that you haven't gotten. Behaviors that impact your daily functioning, any behavior that impact what you do routinely, may be part of the process of identifying a symptom or behavior that needs to be looked at or helped with. Monitor your weight or weight gain or loss, side effects of new medications, and life stressors. We all have them. Our life stressors are often related to lupus flares. How often do you have them? What type of life stressors are you experiencing? All this is part of the awareness and the things that you need to be able to identify in order to be able to get help. What are your typical lupus flares? And sometimes you do have typical flares where there's a reaction to the sun, or you're experiencing different rashes, or you're experiencing inflammation, or excuse me again, or the your fingers or fingertips are turning blue. What are those typical flares that you experience? And so writing them down, keeping being aware of whether or not there is a pattern is important. So once you do this, then you can notice whether or not there's any change. Once you know what your some of the behaviors and whether or not there's a pattern of behavior, then you can notice how it impacts your ability to function. Does it affect your work impairment? Does it impact your relationships, or even your self-care? Has your self-care diminished? Also making a checklist of just your routine activities can help you see whether or not there's any changes in your actually any changes in your health. So we start with the awareness, we look at self-assessment, and now we want to look at things that you can do, coping strategies, coping and prevention strategies. What are some of the things that you can do? So identifying and managing your triggers, knowing what your triggers are. And sometimes we know how to manage our triggers. Sometimes we know if we are experiencing something that may bring on a flare, that we need to relax. We need to maybe not go to work that day. So take some time off. We need extra sleep. So that's managing your triggers, knowing what they are, and then doing what you need to do before the flare comes. So preventative techniques, of course. Exercise, we all can benefit from exercise. Sometimes it's difficult, but we all, if we know ourselves, we know how much exercise we can do. Some of us may be able to walk 20 blocks, where others may only be able to walk 1 block or 2 blocks. So walking, stretching, even yoga, managing your sleep patterns is important. Being able to reach out to family and friends or community groups. Join a support group. Support groups can be very useful, as you saw in the study. Some of the individuals felt that the support groups were very helpful to them. Support groups can be helpful in knowing that you're not alone, helping you to identify maybe a new strategy or coping mechanism that you hadn't thought about, that you learned from someone else. Support groups also can be just very useful to having that connection. Sometimes with support groups, you can invite your family and friends. And if you invite a family member, the family member may be able to come and understand what you're going through, because they're hearing it from other people and not just from you, right? So when to seek help? When do you seek help? You seek help when you're unsure of whether or not those symptoms, those behaviors that you've identified, that you wrote down, your checklist, whether or not they're lupus related or psychological. You're not sure, or if you're dealing with a depressive symptom that I talked about that's just going on for longer than usual or for a long period of time, then you need to be proactive. You need to be proactive and to really go out there and get help, seek help. Seeking help could be getting psychological help, or you can talk to your doctor, and your doctor might refer you for a psychiatric referral or a psychological referral. So seeking help is important. And what kind of help would you seek? What kind of help could be useful? There are specific talk therapies. Sometimes we don't know the differences between them, but they're the cognitive behavioral therapy. I'm sure a lot of people, cognitive behavioral is popular. So you may know or at least heard of cognitive behavioral therapy. So what is it? This is usually therapy that involves helping you to change your thinking patterns. And so some of the strategies might be learning to sort of recognize your distortions in your own thinking that may be creating problems or maybe making you feel more depressed. And so this type of therapy can help you gain maybe a better understanding of your behavior and also help to motivate you. And so cognitive behavioral therapy, that's the cognitive aspect of it, actually helping you to change your thinking. But the behavioral aspect would be helping you to maybe face something that you're fearful of. If you may be fearful of it, telling your doctor about a particular symptom, or fearful of talking to your family members about how you're feeling. And, as I said before, your family members could be very helpful to you in terms of support, family or friends. So sometimes we avoid things. And so behavioral change strategies may help you to face those things that you're avoiding. And so there are also techniques that can help you to calm your mind and relax. With behavioral change therapy, you may even use something called role playing in the therapy that can be helpful. Solution focused brief therapy. Solution focused therapy is a short-term goal-oriented therapy that focuses on positive principles and helping you to sort of change by constructing solutions rather than focusing on problems. And the solutions, the technique uses something called past solutions. Sometimes we don't even think about things that we've done in the past that might be similar to what we're experiencing. So solution focus can be helpful. Psychodynamic therapy can also be helpful. Psychodynamic therapy can be helpful in terms of understanding maybe past behaviors that can interfere with your present. So then in terms of dealing with depression, we want to be able to focus on maybe some of the emotional, the roots of the emotional suffering or the emotional conflicts that you might be experiencing. So it emphasizes more of a self-reflection and self-examination that can be helpful to dealing with depression and or anxiety. And lastly, acceptance and commitment therapy. Acceptance and commitment therapy we considered an action-oriented approach. It has roots in cognitive and behavioral therapy, but it also helps the client stop avoiding dealing with feelings and leads to acceptance. And I think about this when I think about lupus patients, especially in the beginning when you're first diagnosed. It may be difficult to actually accept the fact that this is that there's changes in your body, changes in the way that you do things, accepting maybe that there are things that you can't do anymore. but learning how to make a commitment to change, a commitment to make the necessary changes that's going to make quality of life much better. Okay, so I've done a lot of talking. I think it's important that when you are dealing with depression or anxiety, it is important to breathe. And breathing can help you to sort of settle, to really think about what's going on, what do I need to do, and maybe using some of the coping strategies that I recommended. I don't know if there's any questions.
If you have any questions, please use the question and answer section or the chat. We'll see if we can answer them for you.
Yeah, I'll try. I'll just say while we're waiting for questions that when you are really thinking about distress, you know, or whether or not you are distressed, you can ask yourself a couple of questions. One question might be, do you or someone close to you spend some amount of time every week thinking about the problem? Are you thinking about the same thing or worrying about the same thing over and over again? Do you feel that what you're thinking about might be embarrassing? Are you feeling embarrassed about some of your lupus related symptoms, and to the point that you want to hide from others? You know, and whether or not has your quality of life reduced or changed in any major way? So these are some of the things to think about, to know whether or not, oh, is it time for me to get help?
Doctor, we have a question here. The person is on a phone call, so I'm going to allow her to talk to ask her question.
Okay.
Hello.
She's muted.
Oh.
I think she has to do *6 on her phone.
I don't know. Can you hear us? Here's something here.
Yeah, I can see that she's muted. If she does *6 on her phone, she should be able to unmute herself.
We'll come back to you because we do have another question from Valerie Lawson. How do you find a Black psychologist, one who can relate to my environment?
Oh, that's a good question. Finding a psychologist can be difficult, but there are ways to do so. So I'll start with that. The APA, the American Psychological Association, apa.org has a website, and they have referral services, and they also identify the different chapters for different states. So I don't know what state you're in, but there are different chapters for different states. There is also the Association of Black Psychologists, which is a national organization, and you can also Google them to look them up. They also have chapters in each state, that local chapters, and the local chapters should have referral services to help refer you to a Black psychologist.
Yeah, we finally have Avis got through to us. Question is, when will the scientists come up with a formula that will get rid of lupus once and for all?
Oh boy, if I could answer that question, I would probably make a lot of money. But yeah, that's a probing question, and we know that lupus itself is a very complex disease, and so there continues to be research attempting to um, deal with the different aspects of lupus. We know that lupus affects different organs of the body. And so the complexity of lupus leads to the complexity of the treatment and the research. And so we're hopeful that, one day that they'll be able to come up with more, at least more treatment options.
All right, we have a few more questions here. Somebody wants to know, they're in the tour, they got in the wrong time zone. They want to know if they can watch this. I know we recorded it. I'm not sure about the video, but as soon as we find out about the making the recording accessible, we'll let you know. And maybe there is a video. I am new at this, so you have to be kind to me. All right, are there any other questions?
Yeah, because being able to see it would be helpful, because I
Yeah, you got
had the PowerPoint, and I was going through the PowerPoint. I went through it quickly. So
well, it was being videoed. I can see that. So we'll find out how we get a copy of it. And I know it's being recorded. Are there any, another chat question here. Hang on. What is the best medicine to take for SLE?
the best medicine. I am not a medical doctor. I am a psychologist, so I can talk about the psychological and therapeutic techniques. But the medicine, I really cannot comment on. And I really think that is something for your doctor to answer, your physician, your rheumatologist, because the medicine would depend on your symptoms and your physical symptoms that your doctor would think best for you. And it's different for everyone. There's not one medicine that's going to be best.
Okay, are there any other questions? I don't see any. If you have any other questions, please contact your local chapters. If you want to contact us to get a hold of Dr. Jackson, just send your emails to lenny@lupusnj.org, and I'll pass the questions over to Dr. Sharon Boyd Jackson, and we'll see what we can do to answer them. At this time, I want to thank everybody for participating, and I hope you all got something out of it. I think you did a wonderful job, Dr. Jackson. So
can I give my final thoughts?
You have a final thought? Absolutely.
So I just have final thoughts to remember. When we think about anxiety or depression, it is something that doesn't necessarily last all the time, just like your lupus. Flares don't last all the time. But these are thoughts to remember. One, moderate levels of anxiety can help to improve performance of your experiencing even small levels of anxiety. It may help to motivate you to get up and go to work if you do work, or to motivate you for exercise. To depressed feelings should not be continuous. So if you're having depressed feelings on a continuous basis, then you know that it is time to maybe seek professional help. 3, awareness equals power for action. Being aware of your body, being aware of what you are experiencing, any behavior patterns that you see can help you to know, well, what that it's time to do something, to get help, seek help. And 4, acceptance can lead to control. Accepting what the lupus phenomenon that you're dealing with, understanding it, that can lead to being able to control some of the behaviors, feelings, and lead to a better quality of life. Okay.
Okay, that's your final thoughts now?
That's my final thought.
Oh, good. Yeah, one more comment here from Valerie Lawson, who said she appreciated a very good presentation from Dr. Jackson. So
Thank you, Valerie.
well,
Thank you.
once again, I want to thank everybody. Our time is up. We hope you all enjoyed this and you learned something from it, and hopefully you'll put into practice some of the things that Dr. Jackson has indicated would be helpful for anxiety and depression. And just remember, we always like to say, you're not alone. So you need help, ask your local foundation, join a support group, see a psychologist, ask your doctor for referrals. Thank you very much, all of you, and have a very nice evening and a nice weekend. Thank you. Good night.
Good night.